Bathing your new baby can be a frightening task, especially at the start. Newborns are small, slippery and wriggly, so it's natural to be scared. To make it easier, have everything you need ready before you start and never leave your baby unattended, even for a second.
Now make sure the room is nice and warm. Make sure the place is all clean around you and that you have all your equipment available to you before you start to bath. From once you start bathing your baby, from once you start changing your baby, you cannot go to another area of the room to get anything else because babies can roll off at any age, fracture an arm, leg, skull. So it's very important to stay with your baby when you're on a surface like this. You put your cold water in first, you add your hot, you just check it with your elbow. If it's comfortable for your elbow, it's fine for the baby. It's about 36 degrees centigrade, the water temperature. Again, I have all my equipment here. I have the towel, so I have everything ready to go. Babies sometimes will cry quite a bit when they go into the bath initially because they're been in clear, lying in there very cozy for 9 months. And now they're out and we're changing them and they're also getting used to the new world. So be very, very gentle, take it easy. You put your hand underneath the baby's head like that. You just took the baby under your elbow resting on your hip. When you're wiping the baby's eyes, you always wipe the eye from the inside out. So you put it, you've got your clear water, the water's at the correct temperature, and just back around the face. And just dry the face off now. Sometimes babies get sticky eyes where their ducts don't function that well initially. So that's why we clean them, keep them nice and clean.
Sticky eye often occurs in the first few days after birth. It can happen because blood or amniotic fluid has irritated the baby's eye and caused a yellowish discharge in the corner. Carefully clean the eye with cotton wool that has been soaked in sterile water. That's water that has been boiled and allowed to cool. Always wipe from the inside of the eye, beside the nose, outwards. Use a fresh cotton ball for the other eye.
Now I'm holding the baby in the same position and I'm going to wash the baby's hair. If you're using a solution or buy something that's unperfumed and they don't need too many smelly products, as I said earlier, just wash the baby's hair. Just bring up the water, just wash the baby's hair. Nice and gently. Don't be worried about the head because there are two little soft parts in the head called fontanelles. One closed over in 8 months, the other closed over in 18 months. So just wash it nice and gently. This is a very good baby. And I'm going to come back onto my mat. And I'm going to lie the baby back down and I'm going to dry the baby's head well. Babies lose a lot of heat from their heads, so make sure that you dry the baby's head very well. Sometimes babies get cradle cap. Now you may not see it at the hospital setting and some babies don't get it, but it can happen in the first couple of weeks. Cradle cap is basically a dirty layer on the baby's scalp. It's from old skin cells, sebaceous glands, dust and dirt in the environment, and it's a dirty yellow layer on the scalp. So if you see it, just deal with it early. Just get yourself a little bit of olive oil or a little bit of Johnson's baby oil and just massage the oil into the scalp. Get yourself a very, very fine comb and just comb it through nice and gently and then wash the hair, or even a little brush. And just brush it through and then wash the hair. Now, there's two little soft parts in the baby's head. They're called fontanelles. One is here and one is here at the front. They're soft areas. They will close over. This one here closed over in 8 months. This one here closed over in 18 months. And the reason they're there is to allow the brain to grow, which grows a lot in the first 2 years in a baby. Don't be afraid of them, but just be gentle, but don't be afraid of them. And just I don't want it preventing you washing the hair well or worrying that you can't wash the hair. Now make sure the room is nice and warm. Make sure the place is all clean around you and that you have all your equipment available to you before you start to bath. From once you start bathing your baby, from once you start changing your baby, you cannot go to another area of the room to get anything else because babies can roll off at any age, fracture an arm, leg, skull. So it's very important to stay with your baby when you're on a surface like this. You put your cold water in first, you add your hot, you just check it with your elbow. If it's comfortable for your elbow, it's fine for the baby. It's about 36 degrees centigrade, the water temperature. Again, I have all my equipment here. I have the towel, so I have everything ready to go. Babies sometimes will cry quite a bit when they go into the bath initially because they're been in clear, lying in there very cozy for 9 months. And now they're out and we're changing them and they're also getting used to the new world. So be very, very gentle, take it easy. You put your hand underneath the baby's head like that. You just took the baby under your elbow resting on your hip. Sometimes babies get sticky eyes where their ducts don't function that well initially. So that's why we like to clean them, keep them nice and clean. Now I'm holding the baby in the same position and I'm going to wash the baby's hair. If you're using a solution or buy something that's unperfumed and they don't need too many smelly products, as I said earlier, just wash the baby's hair. Just bring up the water, just wash the baby's hair. Nice and gently. Don't be worried about the head because there are two little soft parts in the head called fontanelles. One closed over in 8 months, the other closed over in 18 months. So just wash it nice and gently. This is a very good baby. And I'm going to come back onto my mat and I'm going to lie the baby back down and I'm going to dry the baby's head well. Babies lose a lot of heat from their heads, so make sure that you dry the baby's head very well. Now, when you're lifting the baby into the bath, just turn the baby over on its side, over in this position. Just put one arm, your left arm, underneath the head and hold on to the left arm. And put your right arm underneath the bottom and hold on to the left leg. Now you see there is no way this baby's going to fall on me. I've got the head well supported with my arm here on the left and I've got a good grip of the baby. Nice and gently, now nice and gently you're going to let the baby into the bath. Just, if the baby's enjoying it, of course, just leave them in for a little while. Babies are very used to water for being inside, so they love the sound of the water. I'm going to lift the baby out again. Now you see I'm lifting the baby out nice and gently. Now, see, you settle them down, give them a little cuddle, settle them down, and then you're going to dry the baby off well. Don't forget areas where they can get sore if you leave them wet. All babies are quite fat in here, so get right in there under the chin, because if you leave areas wet, they're going to get red and sore. They're all get right onto the armpit here, where they're like that. And another area is get right onto the, behind the knees and in the groin area. They're areas that can actually get sore if you leave them wet. So you make sure that you dry those areas off very well. I'm going to do the cord when my hands are clean. So I'm just going to take a little bit of water. I've got a little bit of cotton wool here and I'm going to clean the cord. So I'm going right down to the base of the cord. Go right down to the base. Now the cord stump is clamped at delivery to prevent bleeding. That cord stump is going to get darker over the first couple of days. It's going to fall off in about 5 or 6 days. And when the cord stump falls off, the cord clamp falls off with it. You're left with the newsy area that stays oozy for nearly 12 days. And you clean it for nearly 12 days. And in 12 days, they look like you and I and you forget about them. If it ever gets inflamed, foul smelling, bleeding, always take your baby to a doctor or a clinic. You can just clean the outer aspect of the ear, but don't go in with cotton buds. And if you want to clean the nose and you don't go in with cotton buds into the nose either, you just take a little bit of cotton wool, you roll it between your thumb and finger, you just put it up into the nostril, you just twirl it a little bit and it'll tickle the baby in the sneeze, but nothing bigger than that. Nails, the first little nail is a very light little nail. The first little nail, you could actually just peel it off like that. It's very light. Don't ever bite baby's nails. You can cause an infection. So never ever bite a baby's nail. The second nail, about 2.5 weeks at home, get yourself a little curvy scissors and just cut the nails in the baby's hands once a week from about 2.5 weeks onwards. Baby's toes every 3 weeks because they don't grow as quickly. Initially, when you're busy and learning more about babies, you can actually top and tail every day. And that means you get your bowl of water, make sure it's at the correct temperature again, just put in the cold, add the hot and just check it with your elbow. And then you come along and you just, when you're doing the baby's eyes, you take a little bit of cotton wool, you dip it into the water and you always wipe the baby's eye from the inside out. Right out like that. And then you get another little bit of cotton wool and do the same thing for the second eye. And then when you've cleaned the baby's face, you come on then and then you change the nappy and you make sure you wash the baby's bottom well and make sure that you dry it well. Because when you leave the baby's bottom wet, it can actually get quite sore. When you're buying baby grows, buy something that's easy to put on and off, easy to wash and dry. That's what you're thinking when you're buying. So you'll be washing and drying every day when you go home. Babies throw up a lot, they wet a lot, so you're changing a lot. I would suggest you buy baby grows that are opening down the front. They're easy to put on and off. And all you need to do is just lie the baby grow down, lie the baby on top of the baby grow. So you lie the baby down, you lie the baby grow down, you lie the baby on top, and now it's very, very simple. You put the legs in, and then you put the arms in. Now when you're going through for the little hands, again I want you to go through and bring the hand through so the baby's nails don't get caught up in little bits of thread. Go through with your own hand. Just take a little, grab onto the baby's hand and just nice and gently bring it through. And then just close up the baby grow. When you're washing baby grows and baby's clothes, they should be washed separately to adult clothes for the first couple of months, and also you should use a milder detergent, something that's non-biological for the first couple of months, because babies can get rashes very quickly. When you take your baby home initially, babies don't know the difference between day and night, so they really will sleep and eat and sleep and eat. Newborn babies can sleep for almost 16 to 18 hours a day, so it takes a little while for them to get into their routine. Their tummy's small, so they need to feed frequently. It is important to get the right environment from the word go and to get routines in place. And it's terribly important to keep your baby in the bedroom with you, asleep in their own cot for the first 6 months of their lives.
Put your baby to sleep on a firm, flat mattress that's tightly fitted to the edge of the cot. The safest place for a newborn to sleep is in their own cot, in their parents' room, for the first 6 months. The room temperature is important as babies cannot control their own body temperature. The ideal temperature should be between 16 to 18 degrees Celsius or 60 to 65 Fahrenheit.
It takes a little while for babies to get into a nice routine. This will come eventually, but initially you have to try and establish a nice routine. Feed your baby regularly during the day. Don't let babies go for longer than 4 hours during the day without a feed, particularly breastfeeding babies. Bottle-fed babies generally feed 3 to 4 hourly. Then during the night, when you're putting baby to bed, try and have a nice calm environment. It would be very nice if you could bath your baby before you last feed, because babies can sleep very well after a bath. Settle them down, nice calm voice, a little bit of baby massage if you can. And in the night time, when babies wake up in the night, keep everything dark and dull. No bright lights, no chat to the baby whatsoever. Just feed them, change them and put them down quickly. And soon baby will know the difference between day and night. But that can take a couple of weeks. It's very important that the baby is lying on a good firm mattress, back to sleep, feet to foot. Make sure there's no duvets, bumpers, pillows, nothing that can obstruct the baby's airway. A blanket should be at shoulder level, tucked well onto the mattress. And the blankets that we recommend are cotton cellular blankets. They're the only blankets that are really recommended for the first year of life. It's very important to sleep your baby safely, and the message is back to sleep, feet to foot position. And the reason for this is that the baby can't go down onto the blankets. The only way they can go is up. So it's terribly important to have them feet to foot, back to sleep. And this is also a reason why we don't suggest you sleep with your baby in your bed, because babies can roll under heavy warm duvet and can smother.
During the day, you can place your baby on their tummy with their hands out at either side to support them. This tummy time helps your baby to exercise and strengthen muscles in their neck, arms and shoulders. You must stay close to your baby while they're in this position. Do not let them sleep while they're lying on their tummy.
It's important to get the temperature of the room right for your baby. The temperature that's recommended is 16 to 20 degrees centigrade. Make sure your baby's not lying near, cot's not near a radiator, a window with the sun shining in. Just that they're comfortable but not overheated. And sometimes if the weather's colder, you may need extra blankets. If it's warmer, you can take a blanket off. The message really is, if it's comfortable for you, it's comfortable for your baby. If it's too hot or too cold for you, it's similar for your baby.
Sudden infant death describes the death during sleep of an otherwise healthy infant under 12 months of age. To reduce the risk of sudden infant death in sleep, place the baby on its back to sleep. Don't let your baby overheat. Do not allow anyone smoke. Do not allow smoking near your baby. Do not use pillows or duvets. Do not bring your baby into your bed to sleep. Keep your baby's head uncovered. And if your baby is unwell, seek medical advice immediately.